I'm audible, I guess. Fine. Yeah. So we'll start with the things. Okay. So today we'll be discussing about clinical decision making. So let's see how the things are in that. So clinical decision making is a process, okay, so in which the things will be in a non-linear in nature, and it is a cognitive process. So basically, non-linear means in our body, the most of the things that is occurring, that is non-linear in the process because of the effect of so many hormones or enzymes or so many physiological processes are going on. So due to which the things are not in linear nature sometimes, and that's why we say non-linear, and the process is known as cognitive process for all this in clinical decision making. So first of all, now we need to imagine that if someone is over here, fine, if some patients are coming or someone is coming, and we need to go for certain sort of clinical decision making. So it will be like a certain sort of a tree, and we are standing over there. We need to imagine that what are the future likelihoods over there. So it's like that, and sometimes we don't know any sort of possible outcomes. So that's why there is a process known as clinical decision making, in fact, and through which we can able to understand what is certain sort of possible outcomes over there. So because there will be series of events that will be occurring because of the physiological changes, and we need to understand how the things are on that scale. So if we say clinical decision making, so we need to understand clinical reasoning also in that. It's basically a multi-dimensional approach, which has the non-linear data points over there, and it is a cognitive process. So I guess everyone right now, those who are practicing right now, whenever any sort of patients or any athlete, so whenever they're coming to your place, so we will start thinking on that thing right now. Whenever they're approaching to us, we'll be having a certain sort of thought process that is coming to our mindset, and that is a cognitive area, and we will be visualizing certain sort of pathologies over there only. Fine. So we'll be guessing over there that this could be the issue and all those things, and we'll be framing certain things without having any sort of questions or history taking anything. So that is a clinical reasoning we will be having over there whenever someone is coming up to our place. And it is a iterative process. That means it is a continuous in nature, and it's like a cycle sort of things in which we need to understand so many factors like history taking, examination, observation, evaluation. So likewise, we need to have a certain sort of process involved. So there are two frameworks over there. One is a hypothesis sort of framework, and other is an integrated approach whenever we are trying to do any sort of clinical decision making. So first of all, the thing is that how to decide all those things, because if I read this line over here, what you do have some control over what you can improve. So what are the things in which we have control and we can improve and have a better quality sort of outcome. So that is a major thing we are talking about. So many things we don't not have control whenever we are doing any sort of rehabilitation assessment. So that's why we need to have a certain sort of attributes or outcome of planning, so that we can have a proper decision making and we can decide how the things are, and it is for the betterment of a patient only. So what makes for a good, so what are the things that is going to make a good decision tool? Fine. So there are things like we need to check upon the reliability of the things. Reliability is again of two types, intra and inter-test reliability. Okay. Then apart from that, the tools should be certain thing that is easily can be administered over there or can be used over there. That is, and same thing can be taught again and again. So that is the simple things we need to look upon, and it has to be valid and reliable. So apart from that I was talking in the earlier part right now, that your gut. Okay, so we have so much of gut feeling and intuitive feeling because of our past experience, and past experience again depends upon our learning, and all those things, whatever the school we are coming for, whatever the things we have taught, and whatever things we have learned from. So how much we can rely on gut feelings and all those things. So intuitive. The problem is not with the gut feeling that we will be wrong. The problem is that if something goes wrong over there, so how to validate all those things, and what are the ways we can do a scientific measures to get rid of any sort of difficulties over there. That's why the gut feeling is certain things. Uh, it is a one way of approach, but rather we need to focus on something that is much more factual and scientific. Because if something goes wrong over there, or something is not having a proper diagnosis or rehabilitation planning, whenever we are doing all these things, and then it is quite difficult to defend ourselves. Because my experience, my learning is quite different from other person over there. So that's why the gut feeling is certain things that is much more of a black box, in which things are much more confined, self-centric. And this was one of the interesting thing that I was reading to one of the book. Okay, so that is about a knowledge tracker, something it was coming up. Fine. So what are the things we know right now? We will do certain sort of decision, and there will be certain sort of outcome, and the things will change after that, like a pre and post sort of things. Fine. So to prevent the certain sort of bias, like a gut feeling and all those things, like a hindsight bias and all those things. So we need to understand all those things, because certain things, for example, if you're doing a testing right now or doing any sort of assessment, and the things you know before, right now, in the, whenever you started the career and all those things over there, but right now with your decision making and outcome measures, now you are much more refined version of those things because of the knowledge you have right now. So this is one of the important aspect that we need to understand. We need to keep tracking our things, how we are developing ourselves to get a much more informed decision making scenarios. And because whenever we are dealing with all these things, patient centric and all those things approach, they will be having certain sort of queries and questions, and through the interaction and experience we can have a better verge or control over all those things through a past experience and all those things. So why we want to do decision making? Because we want to know some certain things about the prediction, about the certain sort of diagnosis or prognosis, all those things. That's why it is much more important. And it is going to give us a certain sort of goals and objective to work upon. So whenever we are talking about a clinical decision making, we need to understand about the following things. History taking is much more the important thing. Then what are the risk factor, clinical presentation like a chief complaint, examinations and observations, all those things going to pop inside that. And then any symptoms, any systemic disease and all those things over there. So these all things are going are into the bracket of that. Clinical reasonings was and decision making is having a certain sort of framework. Fine. So we do know that ISF classification is there, and there's something known as ICIDH that was later converted to ICF classification. And it is basically we need to understand, depends upon this all context of clinician goals, knowledge base and expertise, psychosocial skill, and problem solving strategies. These are the key fundamentals that we need to have whenever we are trying to do any sort of clinical reasoning or decision making. And apart from that, there are so many factors like beliefs, that patient having certain sort of belief, we are having certain sort of belief that dry needling is going to work or taping is going to work. That's a different belief, or scientific evidences are there for that also. So whenever someone is coming to us for any sort of treatment, anything, so sometimes we are having close approach also, that is a scenario we will go for this sort of treatment only. Fine. So that is one of the approach also, and we need to limit ourselves in doing that thing, because things are not much more scientific in nature in that point of view, because of those things like we are in a bubble and we'll think in one approach only. That's why. So there's something known as Maitland theory was there on decision making, and that was a brick wall theory. So it has two component over here. One is the theoretical component, one is the clinical aspect over there. So whenever we see any sort of pathologies like a shoulder injury, so if I say clinically, the things will be like a rotatek of injury. It's like one terms or certain sort of ISF classification or certain sort of behavior changes or cognitive changes because of the pain and biosocial models and all those things. However, whenever we say theoretical concept over there, there's so much of anatomical things are involved. There's so much of enzymes are working and certain sort of chemical changes are there over there. Okay, pathological things are working over there, like chemical messengers are working over there, like prostaglandins, interleukins, and all those things over there. So theoretically, the things are quite different, and clinically, things are quite different. So we do need to understand theoretical framework also in that, and depending upon that, the clinical presentation is going to pop up, and depending upon this, the diagnosis is going to come up, and henceforth rehabilitation process and all those things. So clinical decision making is not only about the diagnosis or prognosis, it is everywhere. Whenever we are doing any sort of evaluation or examination or outcome measures, interventions or prognosis or diagnosis, it is applicable to all the phases. We generally think it is all about diagnosis, but how about the treatment plan? Sometimes we think that this treatment is working, and oftenly that is not working over there. So we need to have a iterative process over there, and so that we can look upon this CDM cycle and all those things every time. So whenever we're doing a diagnosis, we need to look upon a different aspect over there. Same applies to prognosis over there, any rehabilitation procedures, outcome measures, examination and evaluations. So this all things, this is also over here, like a stuff you don't know, stuff we know, all the things. Okay, sometimes we don't know anything, sometimes we know so many things, and depending upon certain cases will pop up or certain sort of symptoms will be there, and we will be stuck sometimes. So we need to again go back to the literature and look upon the things, and again come back and discuss about a CDM process. Fine, it is not always like that we know everything. So that's why it is iterative process, and sometimes the decision making is certain things that is much more a bigger challenge as compared to planning or any sort of treatment, anything. Again, there are different frameworks and all those things are there. So clinical reasoning or decision making is centric approach in which we need to look upon clinical skills also, like, and then how much we are patient centric also, and sometimes we need to think about thinking also. Fine, so we think that this is right, but how much that is right also we need to think and discuss. Fine, because there are certain things known as bias, and cognitive biases are several types also. Fine, so we need to look upon the different aspect over there. So this was one of the thing that thinking about thinking is much more important. So as I said in the earlier, fine, there are two types. Okay, there are several types also, but it is like a hypothesis one framework, one is an integrated framework. So let's see how things are in the hypothesis framework. It is basically an algorithm designed to assist clinician in problem solving by considering multiple assumptions or and all those things. We need to formulate a hypothesis over here, and through which a simple series of questions will be there in the form of yes, no responses, and the then the proper this questions will be going to pop up over there, like any research question or any clinical decision making questions. So we need to answer like that. In a similar context, integrated approach is like a same thing also, but it has multiple models over there, which is of patient centric, and it also has a hypothesis driven approach inside it and model learning theories over there. Fine. So this is one of the sample of integrated framework. If you can see, we are having a functional ability exams everywhere. There's a hypothesis approach. systemic review, any sort of musculoskeletal issues, neurovascular, anything, interview history. So everywhere we need to look upon the certain sort of hypothesis or assumptions, and depending upon that, we need to validate all those things. And there are certain things like disability models, enablement models, and all those things over here. Then this is one of the, I guess this is visible. Fine. This is one of the approach of integrated approach in case of stroke rehabilitation. Fine. So there are series of questions we are going to ask, and depending upon the questions, we will go for yes, not yet. If not yet, then there's certain sort of box over here. We need to go over there and look upon that. If something goes over there, not following, so we will go for different box. So decision is all about like a series of yes and no, or certain sort of different questions over there that we need to answer. So there are two scenarios that over here. Suppose you are working for some patient over here, and you planned a certain sort of protocol to work upon. And if the decision that you took to work upon certain protocol is successful, then it is much more good. And if not, then we know how difficult it is to handle sometimes also. Fine. Sometimes there will be some sort of side effect or adverse effect, all those things. So this is about the how decision is much more important over here. In a similar context, whenever we say as a physical, like a patient point of view, they will also look upon the same thing, whether to go to same physio or not. Fine, depending upon their experience and the way of treatment and all those things. Fine, so they will think upon all those things, and this is how the business will going to look upon over here. So again, apart from that, clinical decision making is about there are much more possibilities that we think. That's why we need to have a thorough understanding of clinical decision making, and we need to have a thorough understanding of anatomy, physiology, and pathologies. I'm not going to talk about all those things, and this was just a brief overview of all those things, how the things are in clinical decision making, how why it is important. In fact, because there are so many things that is going to pop up whenever we are trying to do clinical decision making. Fine. So again, this is how things are. We saw in the starting, there's some tree, now there's certain things over there, and things are much more different when we have a proper informed decision making, and this is how the things are in that. So now we can have a I'm open for discussion and all those things, so we can have a discussion round if anyone is having any sort of queries. Thank you so much. Any questions, anyone? No question as such? So this was a brief overview about clinical decision making and how the things work in that space. Okay, what are the models are there and why it is significant and why we want to do it. Fine. And if no one is having any sort of questions, then I will wrap up the session. So if in case anyone is having any sort of queries, please let me know. Otherwise, we'll wrap it up. Thank you so much for your time.
Thank you, sir.
Yeah.